Hello and welcome. And today we're going to talk about diastasis recti. So I see this a lot in my practice as a pelvic floor physical therapist. And, I think there's a lot of myths out there still about it and sort of like outdated information. So I wanted to just talk about all of the things related to diastasis recti. So, number one, it happens in almost every pregnancy and it's inevitable, essentially. We think it happens in nearly 100% of people that go full term in pregnancy. And basically, what it is if my hands, these are two halves of your six pack muscle, it's the muscle separating and stretching. So it's not a hole. A hernia is a hole, but this connective tissue that keeps these two halves of the muscle together, as your belly grows, sometimes you have to stretch. We got to stretch somewhere, right? But there's nothing really that you can do to prevent this. That's a question I get a lot. Like, what can I do to prevent diastasis recti? Nothing. A lot of it is going to depend on your body size, how you carry your pregnancy, and genetics, right? Like, I see it most commonly in petite moms or people that have a short trunk, or they just carried their baby, they had a big baby, or they just carried their pregnancy way out front. Our body has to make room for the baby somewhere, and that's just how it adapts. So there's really nothing you can do to prevent it. The only thing I tell people is if in exercise you see it, so we call it like a doming or a coning. I'll put this video up here where you can see it. If you see that when you're doing exercise during pregnancy, that means that exercise is probably too hard on your abs. Is it going to make your diastasis recti worse? We don't really know, but that's like the one thing you can do to control it. It's safe to work out during pregnancy. It's safe to work your core and your abs, but it might need to be less intense because the abdominal muscles are stretching. So we kind of think of it as like maintenance work during pregnancy. We're not trying to be our strongest as far as our core and our abs go, but maintenance, right? So like keep them engaged. That's important. Keep strengthening if you're used to exercising, but we don't really think that exercise will make them better or worse. But the only factor that you really can control is if you see that doming or coning in the middle with ab exercises or any exercises, then either you need a new strategy or that exercise is too hard. So see a pelvic floor therapist. I see people during pregnancy who just sort of want to figure out what they can do safely, what not to do. And we can teach them how to use their abs. So we sort of think of like our deep core is what we use to sort of prevent that coning or doming. And then postpartum. So if you've gone through a full-term pregnancy, it's considered normal to have like one finger width separation forever. And that's not that much. And we actually measure it more precisely nowadays, but that's kind of like the rule, one finger width, right? So that's considered normal. If you have a little bit of separation after pregnancy, don't stress about it. The other thing I tell my patients is however much it's going to heal on its own is probably going to happen in the first 6 to 8 weeks. So after 8 weeks, if you still have an abdominal separation, or you see coning or doming, or you feel like a hole or a space there, that's the time to see a pelvic floor therapist, someone that can help you with this. Or I also think there are trainers and there are like regular physical therapists that are trained in this too. But just see someone who works with pregnant and postpartum women. And what it looks like, I should ask for more videos from my patients or pictures. So usually around the belly button, you'll see stretch marks that are out to the sides rather than like up and down stretch marks. And the belly button either looks flat, or for some people it looks really deep. Those are kind of like the signs on the skin, on the surface level, that there might be a diastasis recti. We can really only tell by feeling the middle of the muscles and what that feels like. And so, normally if I feel the middle of I've never been through a pregnancy, so when I feel my abs, and if I tighten my abs, I feel it all the way across. But if there's sort of like a dip in there, so usually it's mostly around the belly button, but it could be above, it could be below, it could be just the belly button. If it feels like nothing's there, like it's a big hole or a big valley, that's sort of what we suspect for diastasis recti. So how we test it, if you're lying down, I will feel the center of the abs and then I'll have someone do a crunch, and then I feel along, like, is there a space under my fingers? So we measure it by how wide it is, how many fingers between the two halves of the abdominal muscles. And then I also look for, like, when my patient engages the abs, do they come together or do they just sort of stay there? So we want it to come together with activation. That's how we're gonna fix it. And also I'm assessing for people, how deep is it, right? Is it just, there's a little bit of depth to it, or is it like there's a big hole? So those are kind of the ways we assess it, and there's not really any grading system, we just measure it. But sort of the severity depends on those three factors: how wide, how deep, and then when the muscles are turned on, do they come together, do they pull apart, or do they just stay where they are? And so we work on this by activating the deep core. So the top layer of our muscles is the rectus abdominis, and that's what separates. It has two halves, our six-pack muscle. And then underneath that, we have two layers of obliques, which is like our side muscles, and they go this way and they go this way. That's like when you do side stuff or twisting, that's your obliques. And then the very deepest layer is called our transverse abdominis, and sometimes we think of this as like a corset muscle because it attaches to the spine and the back. And so how we heal diastasis recti is working on the deep core, that transverse abdominis first, getting that to come back together. Then we work on the oblique layers and then the rectus abdominis. And so everyone's different. Everyone wants to know, like, what is the program? There's a lot of programs out there. I think a lot of them work for a lot of people. How long it takes depends on the three factors: how wide, how deep, and do your muscles come together? And so if you just have like 1 or 2 finger separation, 1.5, 2.5, it's not that deep. It's probably going to take 2 or 3 months of consistent work. Maybe 2 to 4 months, I would say, is average. And if you have a bigger separation, like it's really deep, or it's like the whole length of your abdominals, I guess that's the fourth factor, is how long is it? Is it just at the belly button? Is it just the belly button plus some, or is it like everything, the belly button all the way to the ribs, or the belly button all the way down towards the pubic bone? If it's 3 fingers or more wide, that's pretty big, and it's probably going to take 3 to 6 months of, again, consistent work, the right exercises to strengthen. So we heal it by, again, sort of working on the different layers of abdominal muscles, a lot of breath coordination with it, and also you have to challenge the muscles. That's kind of what I hear from a lot of my patients. It's like, I did this app or this online program and it helped, but it didn't challenge enough. And so that's sort of very individual of like how much each person will need to do, or what exercises are going to be challenging enough. So yeah, the bigger it is, the wider it is, the longer it is, the deeper it is. it's going to take longer to heal. And again, that probably just depends on how big your belly was when you were pregnant, which you have no control over. So yeah, and then so we do a lot of deep core challenging. Yeah, you got to be consistent with your exercise and give it time. And the other thing I would say is we used to tell people like, don't do sit-ups. They're bad for you. It's going to pull your muscles apart. But now, like a research study that came out in the last few years, if I can find it, I'll link it in the description. But showed us like actually sit-ups and crunches are good for strengthening your core if you have diastasis recti. Also, every time you get out of bed, every time you get up from laying down, you're basically doing a crunch, right? And then maybe you have to hold your baby on top of that too, right? So these are the things of like why we need to challenge your muscle, and our shiftiness changed. You know, we used to say like no crunches, no planks. Way back, 10 years ago, not that long ago, we used to tell people to get a waist trainer, like those will help. And now generally like, no, like that's not gonna, or belly binding, right? Like that will bring the two halves together. And now we're like, it actually doesn't make that significant of a difference. And really it's just strengthening in a specific way that helps them. I know I wish I could like make an online program for this, but I feel like the things I do are so individual. I don't know. Comment if you want me to make a program. Maybe I'll think about it. And I do have sort of like the same exercises I give people, but yeah, I feel like the people that make it into my clinic are like, they need something different, right? Like the general things aren't working for them. So if you have this, the sooner you take care of it, the better. But oftentimes that first few months of postpartum life is hard. It's hard to get away. You're like sleep deprived, right? You're like, it's just hard. So, you know, get help when you can. I see moms that are like 8 weeks postpartum, but I also see moms that are like 3 to 10 years postpartum. And I would say, like, I haven't seen anyone that had a really big separation that's been like 3 to 10 years, but a small one definitely got better. Yeah, I've seen a ton of moms that are like 3, 6, 10 years postpartum. And even if they have a small separation still, it got better with a little bit of like targeted exercise. So it's never too late. You know, it's going to heal some on its own, but again, if it's not really healed by 8 weeks postpartum, it's probably not going to heal a ton on its own. Generally, strength training is going to help, but really to like close that gap. And I'm using that term, even though like scientists and clinicians probably hate that, because also what we're doing is not just closing the gap, but that connective tissue that's in between, we're thickening that so it holds the muscles together. So there's not just this big like nothing dip. So yeah, I'm not going to confuse you, but that's, yeah, often we have to do specific exercises to close the gap. We have to overload the muscles, just like strength training, anything else. You know, and I think about this a lot, like, yeah, we start really small and basic to get the muscles firing in the way that we want, where they come together and they're not pulling apart or they're not just staying stagnant apart. We want them to come together when we activate. So it starts really basic, but then we have to challenge it, you know, and I think oftentimes we don't challenge our moms enough, and like, you're walking around with this 12-pound baby that you're holding all day, right? And that you have to pick up, that's laying on you, right? They're 12 to 20 pounds. So that's where I think like we got to challenge moms to help them strengthen. So I think that's what I have to say about diastasis recti today. Let me know if you have any questions. Leave them in the comments and I will answer them. And yeah, just know it's never too late to get help, and see a trained professional who works with this population if you have this and you need help. And you can reach out to me. I can do virtual consults if you don't live near me. And we can problem solve how to help you close the gap. All right. See you next time.